Hello, everyone. Our training facility in Anaheim is going to look quite different, and operations are going to be quite different for the time being. We've spent a lot of time evaluating a safe and efficient reopening, and there will be a lot of adapting as we go. But we really need your cooperation to ensure this safe environment. It's a true team effort. Fortunately, you are all used to being a part of a team, so you understand that your actions don't just affect you. The implications are much larger than that, and that's going to be the case here as we begin our operations from the COVID-19 shutdown. We're going to need your help, and we ask you to take these precautions not just for yourself and your own safety, but for others. We would hate to see anyone unknowingly bring in an active virus to the facility and infect others, or have our facility closed down, taking away the opportunity for everyone to train. So please abide by the guidelines. I know at times it might seem extreme and overly cautious, but we would really hate to see this opening reversed, which could happen. But hopefully with everyone's diligence here, we'll be able to move forward. At least for the time being, this is how it's going to have to be with a cautious approach. So just a few notes about while you're away from this facility. While you're away, your actions and your exposure impacts what you bring into our facility. So we really ask that even when you're away from the facility, you be diligent on behaviors and decreasing exposure. Washing your hands, we all know that, using the sanitizer, especially being in public places. The coughs and sneeze covering, we know ideally it's with a disposable paper towel or napkin that you can throw away. If that isn't possible, into the elbow is best. Avoid touching your face. It's ideal to wear a face covering when in public, and I know there's a lot of different viewpoints on this, especially if you're going to be within 6 feet of people. The recommendation is to not come in contact with individuals outside your home within the 6 feet radius. Don't spend prolonged periods of time near individuals outside of your home. There is a certain amount of time that's needed to have a successful infection, and if you are having long conversations with people outside of your home, especially if it's closer than 6 feet, that definitely increases exposure. Do not ride in a car with individuals of a different household. Do not gather in groups. Limit activities to essential errands. And I know this goes deep, but whoever you're living with, roommates, kids, spouses, they also need to be diligent. What they bring into your home exposes you, and then you expose us in our facility. Be extra cautious around those at higher risk, including the elderly and those with medical conditions. Do not visit skilled care centers or nursing homes at this time unless you absolutely have to. The elderly are at the most risk. We all need to take personal responsibility to limit risk and exposure to staff and athletes in the facility, so we ask your help when you're away from the facility to decrease that exposure. So just the necessary criteria to enter the facility. You must have self-quarantined in Orange County for 72 hours if you're traveling from elsewhere, from outside the Southern California region. Obviously, if you're local, then you've been in the area for 72 hours. The concern from travel is just exposure, and so we need at least 3 days of post-travel, post-exposure for if there was an infection incurred, for that virus to replicate enough to be showing up on a test. The false negatives of testing it's a real thing, and the more we can I guess push back the testing from potential exposure is the better ability we have to actually have an accurate test and not get a false negative, which means the test says you don't have the virus but you actually do. Each individual's risk will be assessed through completion of an entry questionnaire. You guys will be asked to fill out a COVID-19 questionnaire in addition to your general pre-participation physical documentation. There's going to be a completion of an education requirement. This note is one, and there's a video to show on site in the facility how operations will go. That will be required. It'll also be required to have a documented negative COVID-19 test. Have any questions, talk to Kara and I. We're requiring masks to be worn upon entering the building, and wear the mask unless you're working out. Wear the mask unless you're exercising. Staff will be wearing masks, and maybe at some point in the near future we'll be able to kind of loosen restrictions here, but at least for now, it's required to wear a mask when you're entering the building. Access to the facility can be denied if any of these requirements aren't being met. If the appropriate precautions aren't being taken, then it's possible that we would need to revoke access to the facility. You'll also be needing to complete health questionnaires twice a day. So we're going to be using the Privet system for this, and I've found this to be challenging to remember to do before and after you enter the facility, so setting alarms in my phone to remind me that I need to do this as well. So staff needs to do this, athletes need to do this. You're going to need to check your temperature and document symptoms or lack thereof before you get in your car to come to the facility. Do not get in your car and come to the facility before you complete this questionnaire. It's very important. And then the second questionnaire is to be completed later in the afternoon. If there's any symptoms or a high temperature, Kara and I will get an email immediately from your response when you submit the questionnaire. And your questionnaire will be checked, whether it's completed or not. It'll be checked upon your entry into the facility. So please remember to do that. Try to get in the habit of that, or have an alarm on your phone. Regardless of the questionnaires, all staff and athletes must immediately report the onset of any COVID-19 related symptoms. That's very helpful for us to be able to activate our response plans. So if you develop symptoms when you're at the facility, let us know. If you've already filled out the questionnaire in the afternoon, but then you start feeling ill later on that night, let us know. We want to take swift action to make sure you're taken care of. Temperature and completion of the questionnaire will be double checked at the ASC when you arrive. We're going to have a health check station just outside the sport performance area, as you'll see in the video that we made. Please don't go into the sport performance area until you check in here, and we can assess the temperature and make sure that you've completed your questionnaire. We really ask that you give extra attention to your hand hygiene, washing your hands, soap and water, or using the disinfectant, the hand sanitizer that's spread out around the sport performance facility and on the courts. The bathrooms and the kind of water bottle ice wet area are the hand washing locations. Don't touch your face with your hands, and if accidental contact occurs, sanitize your hands immediately after you touch your face if it's an accidental contact. So the towels, don't share towels. The blue workout towels that you've been using in the past, those should be used for workouts, and there's going to be red towels around. Those are going to be used for cleaning. There's going to be separate laundry bins, separate locations of those towels. So please don't use the red towels for sweat, and please don't use the blue towels for disinfecting. Nutrition, unfortunately, due to the budget situation with USA Volleyball, we are not going to be able to provide many nutritional products, if any, and we're going to have to assess this as the summer goes on. We'd like to be able to provide services that we've done in the past. We just don't know if that's going to happen right now. So you need to come extra prepared with food, snacks, whatever you would like to have for consumption either in your car afterwards or while you're at the ASC. Please bring your own snacks. Also, this is going to be a big change. Water. We would like you to bring your own water bottle filled and we would like you to try and bring the amount of water you're going to need for the entire time that you're at the ASC. We have bottled water that we can use to refill, but right now, to avoid a high touch point of using the water spout or a water cooler, we would like you to bring your own water bottles filled with whatever water or sport drink or whatever you want to bring that you're going to need for the entire session. So again, another check on the personal responsibility. This is going to take extra attention on your part to bring snacks and water. A few other things. For now, let's not post on social media our workouts and court sessions and videos of that. We're operating in a gray area, and we just want to keep it private. Right now, there's no visitors or non-USA volleyball staff in the sport performance area or on the courts. The ASC is trying to control the number of people on the courts, so no visitors at this time. Schedule. We're potentially going to be very strict on scheduling because we're going to be working a lot of athletes in, and we're spacing out the time and the number of athletes that can enter the facility at one time. So just make sure you're paying extra attention to the schedule and try to be on time the best you can. Sports performance consults. If you need to communicate with Sean or Rachel, Tim, Jimmy, Kara, myself, let's do as much as that we can virtually, limiting the amount of time with in-person direct communication. So facility flow and expectations in the facility, you can refer to the video, the walkthrough video that Kara and I made, but just a couple notes. We ask you to be very prepared when you're coming to the facility. We talked about having a water bottle. We talked about having filled out your questionnaire. If we could limit and minimize the amount of time in bathrooms, the showers are closed at this time. If you could go to the bathroom and take care of everything before you come to the facility, that'd be great. If you could also arrive in your training gear, that would be great. Then you just have to come in, put on your shoes, and get going. Try not to touch anything you don't need to touch. That's just something that hopefully you're getting in the habit of being out in public as well. This is going to be hard. We are not allowing any direct contact. So that means no hugs, handshakes, high fives, fist pounds. Don't touch anyone. And this goes for staff and athletes as well. We're going to require 12 feet distance when exercising. We've worked it out in the facility to allow for that, and we want to stick to that when exercising. 6 feet distancing at all times, 12 feet when exercising. Wear a mask unless you're exercising. And I know a lot of times we like you staying around and doing extra work, and it's great social time, but at this time we don't want you to stay here any longer than you need to. Get in, train, take care of everything that you need to take care of, and then exit the facility. So no congregating or lounging. We're just limiting exposure, limiting contact, and that includes just you're able to arrive early and warm up, but just make sure that you're within the schedule parameters that we've created. So that's it. Please let us know if you have any questions.